From one crisis to another, and the Kenya National Union of Nurses and Midwives has issued a 7-day ultimatum to the government, warning of a nationwide shutdown. This comes barely a day after nurses in Nairobi County downed their tools over unpaid salaries. The union accuses both the national and the county governments of failing to implement the Salaries and Remuneration Commission's advisory on nurses' salary increments. As you'll hear now from Mary Muoki, the strike notice underscores a cascading labor crisis, laying bare deep-seated governance, financing and coordination failures between the two levels of government, now threatening healthcare service delivery across the country.
Solidarity forever.
The Kenya National Union of Nurses and Midwives is sounding the alarm, warning that the country's public health system teeters on the edge of collapse. The union accuses both national and county governments of breaking promises, delaying salaries and treating nurses unfairly, and putting the very backbone of healthcare at risk.
That the national government converted UHC staff into permanent and punishable, those that were working within the national public health facilities. But those who are working at the county government have not been converted into permanent and punishable. Despite their indispensable role in safeguarding the public health, nurses continue to face blatant discrimination, neglected agreements, and inequitable treatment.
At the heart of the dispute are nurses hired under the UHC program. The union says thousands remain on temporary contracts, with some going unpaid for over 7 months despite promises of permanent pensionable employment. They further claim that funds meant to secure their transition were left out of the upcoming national budget.
And therefore you are saying within 7 days, we want to see CBS a serious engagement by the county government to have one uniform collective bargaining agreement that shall apply to all public healthcare nurses within the public sector.
Nurses are accusing county governments of ignoring revised pay structures issued by the Salaries and Remuneration Commission, withholding risk allowances, delaying promotions, and refusing to finalize collective bargaining agreements, some of which have been pending since 2017.
That failure to address the grievances and provide clear roadmap for implementation within 7 days will prompt the union to escalate the matter and engage the nurses for a nationwide industrial action. So if these issues are not resolved within 7 days, we will engage our members across the country with a view of going for a nationwide industrial action for these issues to be resolved.
The strike notice comes just a day after nurses in Nairobi County downed their tools over unpaid salaries, joining other healthcare workers already on strike over similar grievances. Across the country, clinical officers are also on strike, leaving many public hospitals operating with skeletal staff. The union has now issued a 7-day ultimatum, warning that without a clear roadmap for implementation, the nation could face a full-scale nurses' strike. Mary Muoki, Citizen TV.